Okay, hello everyone. Today I'm going to be giving an in-depth presentation over a lot of topics. On the title slide, you'll see some acronyms here. So what we have is CHA, which is Community Health Assessment, CHIP, which is Community Health Improvement Plan, SP is Strategic Plan, PM is Performance Management, and QI is Quality Improvement. I left these acronyms purposefully because the question that hopefully we will answer by the end of the presentation is, what does all of this mean? In the presentation, I'll break it down into three parts. Part one, we'll go over the Community Health Assessment and Community Health Improvement Plan. Part two, we'll go over our strategic plan at Defiance County Health Department. And part three, we'll talk about performance management and quality improvement. So our Community Health Assessment and Community Health Improvement Plan. We just need to trust the process. For years, we have used what is called the MAP process. MAP stands for Mobilizing for Action through Planning and Partnerships. When we prepared for this next cycle of our CHA and CHIP, we wanted to align with best practices across the nation in terms of community health assessment and improvement planning. In doing so, we've adopted the MAP 2.0 process. MAP 2.0 has a direct intention of looking at systems of inequity, power imbalances that may exist, and other steps as far as data collection, where there have been gaps or barriers in the past, how to improve upon those when you're conducting these assessments. The MAP process is broken into three parts. Phase one is to build the Community Health Improvement Foundation, which we have a pretty good foundation in Defiance County since we have been at the Health Department facilitating our Power Defiance County group for a number of years. Phase two is to tell the community story, and this has three parts within it. The first is the Community Partner Assessment. Next is the Community Status Assessment. And thirdly is the Community Context Assessment. Phase three of the MAP process is to continuously improve the community. So these three parts each have a specific purpose. If we look at the top of the screen, Community Context, this is essentially telling the story. It's really looking at a lot of qualitative data. We want to engage the participation of partners as well as community members to complete this part of the assessment. They can share a lived experience. We can learn about strengths and assets within our community, as well as historical context in which the health of our community exists today. The next one is the Community Status Assessment. This is connecting the numbers that exist that we're collecting through surveys with the health outcomes in our community. So traditionally we've administered surveys in our community in Defiance County, and we've done that again through this cycle. There are three surveys. One is the youth survey, which was administered throughout all of our Defiance County middle school and high schools. Next would be an adult survey, which is for adults 19 and older to complete that live in Defiance County. And lastly is a child survey. The child survey is for parents to complete that have children that are ages 0 through age 11. The Community Partner Assessment is the next part in the MAP process, and this one received a lot of updates in MAP 2.0. It really looks at identifying partners that are very strong partners, as well as identifying partners that have not been a part of the process in the past and trying to get them at the table. So some goals we've had in this cycle are to get actual community members, for them to be as equal partners of anyone else, for them to be able to share their story. And they've been involved in our Power Defiance County planning group through this cycle. When you have the support of partners, you can have resources. They can help to look at policy and examine whether or not there needs to be policy changes. They may be able to support data collection as well as workforce and leadership and looking at items through a health equity lens, which may look a little different for everyone. When we do these three assessments together, you can see there's overlapping areas. Based on these areas that overlap, we're able to really identify health priorities and see where there are areas that we could impact the health outcomes in our community. So where are we now? As I mentioned, we have been collecting surveys since spring of 2024. That's where we started in the schools. Over the summer, we have this cycle enlisted the support and contracted with Defiance College to help with data collection as well as data analysis. And so over the summer, they began evaluating that youth data. And now in the fall and moving into winter of 2024-2025, we are currently collecting adult survey data as well as the child survey data, and then we will be planning for focus groups coming up in the winter. And the focus groups, again, are part of the community context assessment. So based on previous CHA data, we looked at groups that have been underrepresented in the past or that we do not have good data sources for, and we strategically have planned focus groups for those different populations. In terms of looking at those three assessments and completing the overall community health assessment, the next step would be to develop the community health improvement plan. This begins by reviewing the data. That would include both the quantitative data that's collected through surveys, as well as the qualitative data or the focus group discussions that will occur with each of those underrepresented populations. In this MAP cycle, we have put a lot of effort into developing a steering committee. We have focus areas that are represented through that steering committee, some from our healthcare or hospital sector, as well as the mental health and addiction services priority, which was a previous priority from the last community health improvement plan. And then we do have community members that are represented on that steering committee as well. The steering committee will review the data, help to identify common themes, and then make several recommendations to Power Defiance County. All of this will then be used to set priorities, strategies, and activities for the next community health improvement plan. So I'm going to move into the next part, which is to look at our agency strategic plan. Our agency strategic plan is created by looking at a lot of different things. And starting off with our community health assessment and community health improvement plan, I wanted to draw a correlation of how that relates to our strategic plan at an agency. When we look at the services and programs that we are conducting at the health department, we want to make sure that those align with the overall goals or objectives for health improvement at a county level. So that's one thing that is taken into consideration when developing the strategic plan. This strategic plan, which spans the years 2023 to 2026, began with a strategic visioning exercise that was completed by health department leadership. Based on that, health department leadership brought common themes to all staff, and all staff participated in a SWOT, or strength, weakness, opportunity, and threats analysis, identifying any of those areas at the health department that we feel are strengths, weaknesses, opportunities, or threats, and could help to inform our strategic plan. All staff and leadership then reviewed the previous strategic plan, which had been conducted in 2019. Themes were identified looking at all of this data, and then all of this was presented to the Defiance County Board of Health for review and any further recommendations. The strategic plan was adopted in May of 2023 and will carry on and go through 2026. So in this strategic plan, the health department used what is called a balanced scorecard approach. Strategic management, there's many different frameworks that can be used for strategic planning or strategic management. And a balanced scorecard is often used in the private sector. However, public sector entities have begun using this approach. The purpose of this is to help organizations measure performance and to ultimately improve their results. This can help to communicate goals. Also, it helps to align our day-to-day work within our agency with the overall strategy. It also prioritizes projects, products, or services within our agency. We can then look at measuring and monitoring progress throughout our strategic plan cycle and see whether or not there's areas that we are improving on over time. So in this scorecard, you'll see our vision and mission, strategic goals, and core values at the top and bottom of the screen. These did not change since the 2019 strategic planning cycle, and so they remain as our mission to promote and protect the health and well-being of all people and places in Defiance County with a vision of a healthy and safe Defiance County. And the core values are to collaborate, respect, educate, empower, and make a difference. The strategic goals did change since our last cycle. And in a balanced scorecard, you will have strategic perspectives. Along the left side of the screen, you'll see our perspectives are community, financial stewardship, internal process, and organizational capacity. So the goals, again, at the top of the screen, align with each of these strategic perspectives. Our goals are to improve community outcomes, ensure financial sustainability, to deliver effective services, and to have a capable workforce. Looking back in column 1 in the color-coded bubbles, you will see the strategic objectives that align with each of these goals. After deciding on strategic objectives, we then reviewed our SWOT analysis, the CHA, the CHIP, and the previous strategic plan to see what initiatives could help us to get to our strategic objectives and ultimately accomplish the strategic goals. These initiatives are then improved or worked towards by setting targets and then measuring those targets. In order to track the progress of the strategic plan or a balanced scorecard, we needed to develop a performance management system. So a performance management system is a tracking tool that will help keep agencies on task and hold them accountable for the goals that they've set. There's a screenshot on this slide that shows some of the results that we have by using the performance management tracking system. This is just a good high-level overview of whether or not each area is staying on track. In this strategic plan for our scorecard, each strategic perspective has its own spreadsheet where they can track specific action items outlined in the strategic plan. Perspective groups then meet to evaluate targets. If there's an area that they see that's lagging, they can find out why it's lagging. Is it due to a lack of funding? Is it due to time management or a lack of staff available for that? Or have some of our priorities or targets shifted for a variety of reasons, whether it be new partnerships or what have you. So now we will go on to look at each of the perspective groups within the strategic plan. As we do this, I'll be able to highlight examples of the measures within each of the perspective groups and how we are tracking those. The first one we'll look at is the community perspective. The objectives within this group are to engage the community and capitalize on partnerships. And the measures are collaborative efforts, the Community Health Improvement Plan action steps, and community engagement. So this group has been actively working on tracking and increasing the number of community engagement opportunities and collaborative efforts made in Defiance County. You can see that the goal for 2023 was for 9 of each of these activities. You can also see that in quarters 2, 3, and 4 that these were far exceeded. So when this group reviewed the goals and moving into 2024, they decided to increase the goals to 24 and 19 for each of these measures. In doing so, the agency has as well exceeded the goals that were set for quarters 1, 2, and 3. Quarter 4 is not over yet, but the agency is set to exceed the goals for the fourth quarter as well. So this is an example of how we can set goals, but you may notice that your goals have to change depending on what you're achieving or what you're accomplishing. This group wasn't sure where to set goals initially because this is not something that had been tracked. Now, having this data, we will be able to more accurately set goals in the future. Another thing that the Community Perspective had been working on was to promote programs and services at the health department. In order to do this, the group started by sending out a community partner assessment, asking how aware partners were of different activities, programs, and services that are going on at the health department. Doing this survey helped to get information to develop the What We Do Wednesday campaign. On the screen, you'll see an example of a social media post for the What We Do Wednesday campaign, and this specifically was highlighting the Safe Sleep program, our Cribs for Kids program, as well as fall prevention programs at the health department. Another thing this group worked on to bring more awareness to programs and services at the health department was our annual open house, which took place on Thursday, October 17th of 2024. For the open house, we had over 60 in attendance. We had each division set up its own area where community members and partners could go through, look at some of the great things that staff are doing within their divisions. We had a wonderful historical display that showed major public health events that have occurred over the last 100 years. Both of these initiatives on the screen, again, are an example of how when we set goals or objectives, together we can identify additional things that can align with whatever those goals are. And in this case, we're trying to engage our community and capitalize on partnerships. Both of these examples on the screen show how we were able to do that successfully. Next, we will move on to the financial stewardship perspective. The objective here is to maximize financial position, and this is done by measuring the average public health cash balance and by looking at diverse funding streams. At the beginning of 2023, the public health cash balance was just over $1.6 million. The goal was set to reduce this balance to $1.49 million. The ending balance ended up being $1,518,000. This was not quite to the goal that was set. However, it was within 2% of the original goal. Overall, there was an average monthly decrease in the cash balance of $9,048. Moving on to 2024, we decided to set the end of year goal to $1,363,735. This is a $127,000 decrease from the 2023 goal. As of October 31st, the average cash balance had decreased by just over $76,000, or 5% overall. This calculates to be a monthly decrease of $7,650. Currently, the cash balance for the end of 24 is projected to be at $1,426,000. This is about 4.6% higher than the goal that we set for 2024. Some of the reasons it's been difficult to spend down the balance in public health is because we've received additional grant funding in areas such as COVID-19 through the COVID-19 Enhanced Operations Grant, as well as receiving additional funding for the Drug-Free Coalition. These funds that are received reduce the need for us to spend out of our public health fund. Another goal within the financial stewardship perspective is to develop a cash balance policy. Over the last year, there's been a lot of research conducted within the agency to look at how we can spend funds so that we could inform a cash balance policy. One does not currently exist. However, as we move forward into 2025, additional work will go into developing a cash balance policy. Now we will move into the internal process perspective. The objectives here are to enhance programming and optimize communication at the health department. This is measured by an updated communication plan and by program plans and evaluations being completed. This group started off in 2023 by looking at all of the programs within each division, creating a list of those. The group also reviewed the communication plan and started updating the plan, and then set goals on what it would look like to accomplish some of the initiatives within this perspective. One of the things that was done toward the end of 2023 was looking at different templates or frameworks that could be used to develop program plans. And toward the end of the year, a tierless logic model program plan was developed. In 2024, the group finalized the communication plan and it was adopted January 15th. The group looked at other tasks for program plans and evaluations and created a spreadsheet to track all of the program plans, SOGs, and SOPs. Those are standard operating guides and standard operating procedures within the agency. Each director selected one or two programs within their division so that they could begin working on the program plans for their divisions. Quarterly goals were set to complete program plans within the identified schedule, and throughout 2024, divisions have continued to work on program plans and meeting with either staff, meeting with myself, or directors as needed to complete those program plans. Here's a screenshot from the internal process perspective that shows how we track some of these measurements. You can see here under objectives we have enhanced programming and optimizing communication. And then we're looking at program evaluations. You don't need to pay too much attention to the weight of these. That just helps us to sort of measure how big of an impact completing those has on the overall strategic plan. But we can look at the target initiatives. So for enhanced programming, program evaluations, we had set a target initiative of completing 2 of those, and 2 were completed. And then program plans, we had set a target initiative of completing 2, and 4 were completed. And then updating the communication plan, that's 1 plan. So the initiative was to just complete the plan, which was accomplished. And so that would give us 1 initiative completed. So we can see that we met and even exceeded the targets for those areas. The next steps as we round out 2024 and move into 2025 are to continue the program plan for each division. So each division has their list of programs. They'll work through those. That may include updating standard operating guides or standard operating procedures for each division. Once we have most of our program plans completed or at least in progress, we'll be able to start looking at those and getting those on track for evaluation. The most important thing with these is to have a way that we can hold ourselves accountable, also have a schedule as we're creating program plans. We'll then have those on a schedule so that they can be reviewed and updated as needed. Our last perspective is the organizational capacity perspective. The objectives here are to improve information systems or information technology and strengthen our workforce. This is measured by completing an IT assessment, updating the workforce development plan, and looking at staff retention. For this group, in 2023, the group looked at the onboarding process for new hires. This process was redeveloped, looking at a 30, 60, and 90-day check-in between supervisors and their employees. It was further improved by implementing electronic surveys for new employees to complete at these time frames. after hire, at 30 days, and after 9 months of employment. There have been a lot of discussions regarding IT within the agency. We have had our IT contractor review our current systems and recommend improvements for those systems, whether that be individual machines, software, or our IT services as a whole. There's been discussion about moving to hiring of an IT person within our agency, and along those lines, it was necessary to create a position description for an IT professional. Conversations continue along these lines, and the agency is looking at different avenues and what would be most beneficial for the agency, for staff, and for the individual needs within each division to have IT needs addressed. Some other work that was done in 2023 was a discussion of sending out a staff satisfaction survey and having an all staff meeting by possibly extending one of the weekly morning meetings as part of our staff retention efforts. This would just provide more time for staff to be able to know what's going on from leadership, and providing an opportunity for questions to be asked or larger updates to be reported out to staffs. In 2024, the group met and looked at a buddy or mentor program for new employees. This kind of goes along with onboarding. Sometimes it's helpful to have a staff member that has been at the agency for a while, more of a peer that could buddy or mentor new staff in some of the work tasks, or just getting acclimated to the work environment. The workforce development plan has been reviewed and is being reformatted into a plan that is more usable based on data that we've collected from staff. This plan is continuing to be reviewed by leadership and will be implemented by the end of 2025. A staff satisfaction survey was also sent to staff in the spring of 2024, and those results were recorded for leadership review. The staff satisfaction surveys have been used to look at trainings that could be brought to the agency. Some other notable achievements that were not directly listed in the strategic plan, but I believe are a result of these goals, which are to strengthen our workforce and improve IT. Workforce development funds received from the state have been used for staff trainings, and these have been well thought out trainings that are beneficial to staff through staff feedback, things that we know will both align with our strategic plan, but also the community health assessment, community health improvement plan, and maybe individual goals that staff have. Some of these trainings include health equity trainings and health literacy. And then the agency has planned an additional workforce development day for the month of December. We always have a workforce development day in the spring. Well, we have planned an additional day and are bringing out a trainer from the outside to address specific needs within our agency. So I have just gone over a lot of information in a little bit of time. We looked at each of the strategic perspectives, the objectives within those groups, and then what are we measuring? How do we know that we're doing what we say we're going to do? I wanted to bring it back a little bit and show this timeline, which goes back to April 2022. As I mentioned at the start of this presentation, our strategic plan started with a visioning exercise. Over the months and over the years, we've had one thing lead to another to get to where we are today. I have the end goal here of December 2025 because that is when our goals are set to be accomplished by. This strategic plan will last from 2023 to 2026. So by looking at our performance measurement system, looking at our tracking, we can know whether or not we're on task, and we can add in additional meetings, checkpoints, whatever we need to do to make sure that things are on task. So the cycle continues. This slide is to show the relationship between performance management and quality improvement. And this is our last section that I promised I would get to. To put it simply, performance management and quality improvement are very closely related. Performance management provides a structured framework to identify areas for improvement, and this is done by using data, while quality improvement or continuous quality improvement leverages that data and can implement change. This can always enhance processes or improve processes, and ultimately this leads to better performance within an organization. Essentially, performance management is acting as the measurement tool that informs the quality improvement initiatives. And this allows for targeted interventions to achieve better outcomes. So we can see here in performance management, we set goals, we have to measure those goals, and we have to look at our progress. This can lead to quality improvement ideas. An example of this was the onboarding process. We plan for a new process, we do it, we implement it, we study it, we see if it's working well, and then we act. Are there changes that have to be made? Is it good to implement as is? And we just continue through that cycle to always improve whatever the process, program, or service is. But it's a two-way street. Performance management informs quality improvement, and quality improvement initiatives can inform our performance management and whether or not we're accomplishing those goals. Just looking back again at our balanced scorecard, we can see how all of these things are related. We've got our mission, our vision, our goals, and our values. That's the foundation of all of the work that we're doing at the health department. We want our objectives within the strategy map. We want our objectives to align with our foundation. That is why it's so important to align all of this work with the community health assessment, the community health improvement plan, so that we can make sure the work that we're doing is valuable within our community. That's providing those essential public health services in our community that we need to do so that we have a strong public health system. We will continue to measure, to review, to look at progress within the strategic plan, and then as we get into this final year, 2025, at the end of that, we'll begin the strategic planning process for getting into 2026 and look at a new plan for the subsequent years. Our community health assessment, community health improvement plan, strategic plan are all available on our website, so you can find those at defiancecohealth.org. And again, I'm Brian. My email address is here. If you have any questions, please reach out. Thank you.